Hello everyone, my name is Siri Vennela and I'm a second year student. I'm grateful for the opportunity to present today and I would like to thank my teacher, Madam Ageva. Hepatocellular carcinoma is a type of primary liver cancer that begins in the cells of the liver and is one of the world's deadliest and fastest growing tumors with a poor prognosis. It develops in the context of chronic liver disease such as cirrhosis caused by hepatitis B or C infection. It is the most common form of liver cancer. TP53, third promoter, CTNNB1 mutation, axin mutation, ARED mutation, CDKN mutation, and CCND1 mutation are present in hepatocellular carcinoma. Targeted therapy is a drug treatment that targets the cancer specific genes and contributes to the cancer growth and survival. These targeted therapy drugs are often used in combination with other treatments such as chemotherapy, radiation therapy, and surgery to provide the best possible outcome for the patients with liver cancer. Examples of target therapy drugs used in the treatment of liver cancer are atezolizumab, which is a type of immunotherapy called a checkpoint inhibitor. These checkpoint inhibitors block proteins that stop the immune system from attacking the cancer cells. Bevacizumab also works by stopping the cancer growing blood vessels. Sorafenib is a cancer growth blocker which works in two ways. It stops the signals that tell cancer cells to grow and stops the cancer cells forming the new blood vessels which they need to keep growing. Regorafenib is also a cancer growth blocker which is used as a second line treatment after the treatment with sorafenib. Immunotherapy is a type of cancer treatment that works by stimulating the body's immune system and strengthening its natural response to tumor cells. Some examples: combination immunotherapy includes anti-PD-1 and anti-CTLA4 drugs. This combination showed remarkably synergistic effects in the liver tumor inhibition. Immunotherapy before liver cancer surgery can also be given as the liver cancer tumors die off in the one-third of patients enrolled in clinical trial. Immunotherapy uses the immune system to fight cancer. Regorafenib, sorafenib, and cabozantinib are examples of targeted drugs that can be used as immunotherapy for hepatocellular carcinoma. Immunotherapy can enhance the cancer-fighting immune system responses but may not always be available or viable for the patients with a history of hepatitis infection. Dendritic cell-based vaccines have been studied as a potential immunotherapy for liver cancer. A study on an orthotopic mouse model showed that the combination therapy with dendritic cell vaccine and programmed det ligand 1 immune checkpoint inhibitor can be a novel therapeutic strategy for the hepatocellular carcinoma. And a review summarized the evidence from clinical trials and recent preclinical studies regarding the evaluation and optimization efficacy of dendritic cell-based vaccines either alone or in combination with various anti-cancer therapies or immune effector cells in treating the hepatocellular carcinoma patients. A phase 2 clinical trial investigated the safety and efficacy of intravenous vaccination with mature autologous dendritic cells pulsed with the tumor lysate in the patients with hepatocellular carcinoma. And an early phase 1 trial studied the side effects of autologous dendritic cells and a vaccine called Prevnar in treating patients with liver cancer that cannot be removed by surgery. While dendritic cell-based vaccines have shown a promise as a potential immunotherapy for liver cancer, more research is needed to determine their safety and efficacy in treating hepatocellular carcinoma patients. How dendrite cell vaccine works. Dendrite cells are the antigen presenting cells that can activate T cells and initiate immune response. The antigens used in dendrite cell-based vaccines can vary depending on the patient's tumor. Some vaccines target surface-exposed antigens, while others aim to induce a tumor-specific B-cell response. Clinical trials of dendrite cell-based vaccines for hepatocellular carcinoma have shown promising results with some patients experiencing tumor regression or stabilization. There are also the toxic effects of dendrite cell-based vaccines, which are generally mild and include fever, fatigue, and injection site reactions. Designing the dendrite cell vaccine steps: isolation of dendritic cells from patient's blood, loading with the tumor antigens, maturation using cytokines, and administration of the vaccine back into the patient to stimulate an immune response against the tumor. The choice of tumor antigens is critical for the success of vaccine. Neoantigens, which are derived from the tumor-specific mutations, are the ideal targets as they are less likely to be recognized as self-antigens by immune system. Tumor lysate, which contains a broad range of tumor antigens, can also be used. The choice of cytokines or TLR agonist used to mature dendrite cells can affect the quality of immune response. For example, TLR3 agonist can enhance the cross-presentation of antigens to CD8 plus T cells, while TLR7/8 agonist can promote the production of pro-inflammatory cytokines. Route of administration, and there are some rules present for the combination therapy. Conclusions: evidence for strategies to develop and test dendrite cell vaccine-based immunotherapies for the treatment of hepatocellular carcinoma. Dendrite cell vaccine, alone or in combination with anti-tumor therapy or immune effector cells, seems to be a promising area to explore as a therapeutic approach to personalized medicine. Important for the design of an effective dendrite cell vaccine is the choice of tumor antigens, optimality of reagents that can stimulate the dendrite cell maturation. Therapeutic strategies focus on a combination of dendrite cell-based vaccines with or without immune effector cells. Thank you for your attention.